is the first one in 3 weeks that wasn't competing with the World Series. So for those of you who came, some of you came in spite of the fact that there were 2 World Series games. Thank you very much. You get the best seats. You can guarantee best seats in the house. But we're glad that we don't have that competition. And for those of you for whom this is the first time, welcome to the Myra Kraft Open Classroom series. And this is a series where we focus on healthcare policy. And every week there's a different group of speakers, usually 2 speakers, who are just leaders in their field and incredibly knowledgeable and helpful in terms of our understanding the key health issues that we're facing now in America. And that is true this evening as well. We do hope you join us each week, and I'll talk at the end of the program about the speakers who will be coming next week. Let me see if I go here. So today, we are going to be focusing on the important issue of prevention and wellness. And what we looked at a lot of different aspects of the way that the healthcare system has functioned up till now in a variety of different arenas, but looking at the issue of how can we keep people healthy? What are the things we can do to avoid expensive hospitalizations, bad health outcomes, is really the focus of this week's talk. And in particular, we're going to be looking at the epidemic of obesity and the chronic diseases and other health issues that have resulted from that epidemic, which has largely begun in the 1970s and now led to very serious health problems. And you'll be hearing about some of what those health problems are. We have 2 incredible speakers, 2 speakers who are really national leaders and frankly heroes to those people who work in the healthcare field and are interested in working on the issues of prevention and obesity. And they're heroes because they have long histories of working on these issues, but also because they're doing some of the most innovative work in the country. The first person that I want to introduce, I'll introduce both of them and then they'll speak one at a time. The first person that I'll introduce is Paul Kuehnert. And Dr. Kuehnert is from, might just stand for a second so that people know who you are, then you'll come up in a second. So Dr. Kuehnert is the Director and Senior Program Officer for the Public Health Team at the Robert Wood Johnson Foundation, which is the largest foundation in the country that focuses on health. And Dr. Kuehnert comes to this position at the Robert Wood Johnson Foundation with an incredibly rich and diverse set of experiences. He's trained as a nurse practitioner with a focus on pediatrics, and he has worked in as diverse areas as a Head Start program in St. Louis. He then led a community-based agency in Chicago that was very much focused on the issues that have an influence on health. He then went to the Maine Department of Health, the state health department, and then did critically important work on regional health, very rural state where delivery of public health services is a challenge, and eventually became deputy director. He then left that to become the local health commissioner for Kane County in Illinois. And in that role, he did some incredible work around promoting good health, combating obesity and other health problems. And a lot of the lessons from his experience, other people like myself have used and said, wow, that's really a model that the rest of us can follow. And now, of course, he's in the position at the Robert Wood Johnson Foundation of looking at some of the best practices in the country and determining how to nurture those, support those, and then spread the word on health. Our second speaker is the Commissioner of Public Health for Massachusetts, Cheryl Bartlett. And doesn't she look like she's has wind blowing through her hair, like she's a fashion model? And she looks like a fashion model. Commissioner Bartlett, would you stand so people could just see for you for a minute? Just
not as relaxed anymore.
Commissioner Bartlett also is a nurse, and in fact the first nurse who is the Commissioner of Public Health in Massachusetts. And so for those people, how many people here are nurses? or studying to be nurses. So she is a wonderful role model in terms of the important leadership role of nurses in government and in health. She also comes to us with a remarkable background. She's trained at Yale in nursing, and then spent many years on the front lines doing community nursing under, in some cases, the most challenging of conditions. She was the island nurse for Nantucket. And so what that means is, and she was just explaining the example of this, is you do everything. Because when you're on an island, you have to be able to provide the full range of healthcare services because it's too difficult to get many people off the island when a medical problem occurs. So she essentially, I'd say, worked in everything from the operating room to outpatient to home visits. And I first met her maybe 20 or so years ago when she was leading the charge on developing HIV work on the island of Nantucket at a point that most people didn't want to talk about HIV, didn't believe that there was HIV on Nantucket. Commissioner Bartlett really led the charge and developed what became certainly a statewide model, if not a national model, of how to develop comprehensive HIV prevention and treatment services. She, over the years, did other community-based and hospital-based work on Cape Cod, and then came to the Department of Public Health, where she oversaw chronic disease and prevention and community health work, and oversaw the development of many very significant programs, including one she's going to be talking about tonight. She then became the Deputy Commissioner, and now she is the Commissioner of Public Health, and has done incredible work in terms of ensuring that the Commonwealth has the appropriate policies and programs to address issues like obesity. So I think we're going to hear them in the order that I introduced them. And so please join me, first of all, in welcoming Paul Kuehnert. No, don't join me in welcoming Paul Kuehnert, because in fact, we're going to welcome him, but not yet. We're going to start with Commissioner Bartlett, and she's going to bring us.
Thank you for having me here tonight. It's really exciting to be here and to talk to you about some of the work we're doing here in Massachusetts, particularly around obesity and chronic disease prevention. And Mass in Motion is really trying to transform communities, and it's a public health campaign to promote health and wellness. And why are we doing this? In Massachusetts, as across the nation, 2/3 of adults are overweight or obese. And we're actually number 3 for doing the best in terms of obesity in the country. And so 2/3 of our population still needs to do something about being overweight or obese. The purple communities are those that are now working specifically on community transformation and obesity efforts. Diabetes. About 8% of the population has diabetes, and as you can see, the darker the color is, the more the prevalence is, and again, many of our Mass in Motion communities, about 1/3 of them have the highest rates of diabetes. Hypertension. Again, about 50% of people who have hypertension are uncontrolled, and so this leads to other conditions such as different cardiovascular disease, kidney disease. So very important for us to get a handle on this. And then, despite our best efforts here in Massachusetts, we still have about 15 to 18% of people who are smokers. And then looking at disease factors in terms of disparities, many populations have higher rates of chronic disease, and we see in males that they have higher rates of hypertension, diabetes, and are current smokers than females. And then if we look at racial and ethnic minorities, we see that African Americans have the highest rates of most of our chronic diseases, and Hispanics follow closely behind. Household income is a really significant indicator of whether or not someone has a chronic disease, and less than $35,000 a year income has twice the rate of chronic disease in a household making $75,000 or more. And less than a high school education, again, is a high indicator of health. And these are important factors when we think about what interventions we want to put into place, because it isn't just clinical care that makes people well. It's really looking at what the social conditions are that make people sick and what can we do about those social conditions. And that really is the new framing in public health today, really thinking about policy and systems change that really change the conditions where we live. So the healthy choice is the easy choice. Many times we spend most of our resources and time trying to do individual counseling or clinical interventions, and you can see that we need increased effort in order to have an impact in that population. So if you think about 2/3 of the population in Massachusetts being overweight and obese, if we tried to go one by one and do clinical counseling or interventions, it would take us a really long time and we may never get there. So really changing the context of where people live is an important part of our work today. So Mass in Motion really came out of that. It came out of first a call to action where we looked at what was the burden of obesity in Massachusetts. And again, a lot of this was under the leadership of former Commissioner Auerbach, who I had the great opportunity to work with for 5 years at the department. And we really realized that this was an emerging epidemic and we wanted to do something about it. And so we created this multifaceted campaign with the governor instituting an executive order that required any procurement of food in the state of Massachusetts to have nutrition standards implemented. We implemented BMI regulations where all students in grades 1, 4, 7, and 10 had their BMI screened and sent to the Department of Health so that we could begin to see where we had the largest burden of overweight and obesity in our youth. Adults, we have 2/3 overweight or obese, but in our children entering school, 1/3 of them are overweight or obese. And in middle school, we're seeing children with chronic diseases, things that we would have only seen in adulthood. We implemented school nutrition standards, and that is in schools there's 2 ways that kids get lunch. One is the federal school lunch program, which is a meal that's served to the child with certain nutrition standards, and then there's competitive foods, which can be bought a la carte in the cafeteria. And for some reason over time they have really trended to be junk food that kids are buying in school. And so we implemented standards that said what kinds of food could be sold in the competitive lunch program. We changed vending machines, we eliminated sugar-sweetened beverages, and we reduced the snacks to having 100 calories or less in vending machines. We put out a newsletter called Chop Chop, a nutritional newsletter that gave simple and easy recipes so that families could learn to cook. One of the things is that this obesity epidemic has doubled over the last 20 years, and if we look at how our society has changed over 20 years, we eat out more, we eat bigger portions, and we get much less physical activity. We have more screen time as our recreation than we once had. So really looking at ways that we could get families thinking about having meals together again, and it's an opportunity to teach your children about good nutrition. Mass Children at Play is targeted at a regulation that all children that go to licensed daycare facilities get 1 hour of physical activity in a day, and also some nutritional guidance to the foods and snacks that are provided at daycare. We had many public information campaigns so that we could really get the message out, trying to brand Mass in Motion as something that might urge people to start thinking about what their physical activity and nutritional status was. And the cornerstone of our initiative has been our municipal wellness grants that I'll talk about more in detail. We also did some pilot worksite initiatives. A large part of the population that's at high risk for lifestyle and behavior risk factors is at the workplace, and we wanted to find ways that we could encourage businesses to promote health and wellness at the work site. And we also have an interactive website that allows consumers to come in and see what they're interested in, that has low-cost ways of showing people where they can go and have recreation. We have over 700 parks in the state of Massachusetts that we really wanted to promote the ability for families to get out and have some free recreation. And then we have a very robust evaluation so that we can really understand if we're making an impact and where we're making the impact and what things are most effective so we can target our resources more effectively. Another important part of our movement for health and wellness in Massachusetts as part of transportation reform was the inclusion of a healthy transportation compact. And it's really looking at how could we promote healthy, livable, and sustainable communities through land use, transportation, and public health policies. We want to promote walking, bicycling, and other forms of public transportation through our different state policies and programs. So this is in conjunction with the Department of Transportation, who has many different ways that they're promoting wellness across the state. I think we have the Hubway, which is bike stations that are scattered throughout the city as a way that people can take a bike from one location to the next. And we have safe routes to schools that the Department of Transportation has really been promoting. We really are encouraging all municipalities to adopt a complete streets policy, which is when you're designing a development or a neighborhood that you're thinking about all users, pedestrians, bikers, and motor vehicles, but not just designing our neighborhoods for the car. And it's been actually demonstrated that people that use public transportation actually walk 30% more than people that don't use public transportation, because often you walk from your home to where the public transportation is. So again, encouraging public transportation through different kinds of incentive programs. And one key new strategy we've been implementing is the use of a health impact assessments, which really looks at a transportation project and doesn't just think about it for the design of moving around people, but also what design would also improve health the most. Sometimes a highway going through a community actually decreases the safety for walking or economic development, and so places that might be really good recreational areas are really safety issues, and so communities don't really have good opportunities there. So we have done a pilot through the transportation with Grounding McGrath. And I don't know if people know the McGrath Highway, but it's the elevated segment of highway that's in Somerville. And around it, there's a lot of dark areas, there's a lot of crime going on and drug activity. And so that's been a really an unsafe place. And so the highway needs repairs. And so the conversation with the community began about what would be the best way to redevelop that highway. And a lot of the community was calling to lower that, make it on a ground level so there was better lighting, there was better walkability, and that there would be better economic opportunity around that. I think it was determined that the cost of doing that was really too high to implement, but they are looking at some other ways of making that a safer neighborhood. But that was one way that the community could come together and think about what were all the alternatives to get the best outcome for the community. So that led us to apply for a CDC grant, and we got one of 6 in the nation health impact assessment project grants, where each year we have to implement 3 different health impact assessments. And we started out doing this in transportation because that was a real common way of implementing an assessment. But we're really looking at this in terms of housing and other kinds of transportation, how we develop land in the community, if there's open space, what is the best use of that property. And we are also beginning to look at policies that come at a local level and policies that come at a state level. Can we make a policy that really will have the best opportunity for health improvement? And then we're doing trainings. Our goal would really be to work with all the planning agencies across the state so that they implement health impact assessments in all of the work that they do. Our goal being to really thinking about health in all policies, health in all sectors. Just the healthcare sector alone isn't what makes us healthy. It's looking at education, looking at economic opportunity. Those are all determinants of our health. We created interagency partnerships. In the state, sometimes as the work that we do, we tend to get in silos, and we just think about health again from the Department of Health and that being our responsibility. But we realized that we really wanted to promote local agriculture, and that we worked with the Department of Agriculture, and we have a food policy council now, and we want to see how is it we can enhance and expand our agricultural productivity in Massachusetts. And then in terms of recreation, with conservation and recreation, again, they have these 700 parks, and how do we encourage our residents to get out and use those and promote healthy living. So some of the parks have developed different kinds of exercise programs and activities in them so that the community can really benefit from learning about physical activity. And then working with the Department of Transitional Assistance for their SNAP program. They had a pilot program on how to give incentives to see if they could incentivize folks using food stamps, that if they bought the healthy choice, they would get another third more of resources to use to purchase food, and see if we could incentivize more purchase of fruits and vegetables. And also we got our farmers markets to accept SNAP coupons. So Mass in Motion, our municipal wellness and leadership grants, again, what we consider the true cornerstone of community and local change. It was really initiating and expanding on policy, systems, and built environment change through healthy community design, and to consider this health in all planning approach. It promotes health equity. We really want to look at the place where people live and try to make sure that all voices are heard, and so we have communities engage traditional and non-traditional stakeholders together to make sure it's representative of the community that they live in. And so we fund coordinators in many communities that bring together multi-sector coalitions and work groups, and we have them do assessments of their community to see how healthy they were around healthy eating activities and physical activities. And every year they have to implement a strategy that improves healthy eating or improves physical activity opportunities. And I see Pauline here today, who is actually one of the leaders in Mass in Motion in Massachusetts from New Bedford, who did really remarkable work in implementing all sorts of new activities in her community. It's really been enormously successful. It's been a public-private partnership. We actually implemented this at a time that the budget was going really badly south on us, and our health promotion budget when I first arrived at the department was $16 million, and I think now we're eking out about $3.1 million, which is really woefully sad. But Commissioner, very creative, said let's go to our private partners and ask some of the health foundations if they would be willing to contribute, because we're all trying to improve health care, and instead of doing it one by one, maybe we could come together and form this partnership. So despite a difficult economic time between the money the department brought to the table and our funding partners, and we actually had one private insurance company that contributed to this, we were able to put together $1 million, and we funded originally about 11 what we call our legacy communities now to take this new approach to health and wellness. So this was our original number of communities that were funded. A couple were funded together, Tri-Town. And what this did for us is we really began to see some early successes. We saw that by coming together as sectors, that things that communities couldn't really do, they could do if they did it collectively. Just like we came together with multiple partners to fund Mass in Motion, oftentimes in a community they operate in silos. So in some communities it's the Department of Public Works that's responsible for sidewalks, and each year they'll budget a certain amount, and if they don't have enough for a sidewalk, well, there won't be any sidewalks. But we found by just bringing them together within a few short months, we found that, well, the health department wants people to have sidewalks too, because that's good for health and wellness. And economic development wanted sidewalks because that might get people walking to the retail stores in the community. And so together, 3 departments put the money in, and they had sidewalks within 6 months. So we began to see this change in the built environment, which I think communities saw as great successes, that people could now start to walk, enjoy their community, and they had new assets in their community. As we were learning of these successes, the federal government came out as part of the Affordable Care Act, created its own prevention trust, and put out community transformation grants. And we applied for those, and we are the only state, I'm proud to say, that got 2 community transformation grants, and we get a total of a little over $3 million a year. One of the grants is to work through Middlesex, what was formerly sort of Middlesex County. We work with the Metropolitan Area Planning Council and the communities that they serve. And then we work with what we say the rest of the state and our small counties and we have 8 new Mass in Motion programs in those communities. So we were able to expand from our 11 legacy communities to 52 municipalities across the state, and that represents about 33% of the population. At the same time, we applied for a Mass in Motion Kids Grant, what we call now. It was an obesity research demonstration project, again out of CDC, one of 3 states that got funded to do this. And this was to really take a targeted approach to children ages 2 to 12 and look at all of the domains in a child's life and have a strategy for intervening on overweight and obesity. Again, our Health Impact Assessment Grant. And I'm also happy to say that because of this success, we were able to get one of the largest healthcare systems in the state to come to the table. They saw the success we were having, and they wanted to work with the communities where they had community health centers to take the same model and approach to their community. So we were able to get another $2 million from a healthcare system. So now we're here we are in all of our different communities, and I like this because it kind of helps me keep track of who pays for what. The purple are the original Mass in Motion grants. The purple stripes are New Bedford and Fitchburg, who really took on the Mass in Motion Kids pilot project, and orange is Middlesex County, and green is the rest of the state. These are just a list of them all. People often ask me if there are towns in it, and I can't remember all 52 towns on a regular basis. So community transformation actually took the idea of policy and systems change to clinical care. And so we were working more on healthy living and lifestyle changes, but this was how do we start to intervene and have a population health approach to clinical care. And so the 3 main outcomes from community transformation is to reduce morbidity and mortality by 5% due to the use of tobacco, reduce obesity by 5%, and reduce heart disease, especially targeting decreasing blood pressure. So some of the activities that our Mass in Motion communities implement are the school nutrition regs. At all 52 communities, there's certain things we have them all do, and then we let some communities be flexible and do things that are really specific to their particular community. We have this great healthy dining and restaurants. Again, I think New Bedford was one of the leaders in that, where the mayor gave a citation if you had on your menu healthy food choices, looking particularly at children's menus at first and not having French fries be the staple part of the entree and as the side dish, but that the French fries had to be paid for extra, and that we gave them vegetables as their main side dish. And then some restaurants put in calorie counts, some identify them through hearts. There's different ways that different communities are identifying their menus to acknowledge healthy food choices. We're also doing a corner store initiative where we're trying to, in some places, what they call food deserts, where there really are grocery stores that give people wide selections of healthy fruits and vegetables. And we're asking corner stores to think about providing those as options. So you may start to see in 7-Elevens fruits and vegetables at the front of the cash register. And we're trying to put them in places, instead of the candy being there on the counter as your last impulsive buy, maybe a banana or an apple would be something you'll grab on the way out of the store. Again, the use of SNAP and food stamps at farmers markets. We've really been working with the farmers markets across the state, and those are really becoming popular. We're also looking at them in terms of how to address some of the issues about transportation for some of the lower socioeconomic status population. Getting to the farmers markets can be a challenge because they're often out of the way, and getting there isn't easy on public transportation. So we're trying to find transportation. Some communities have been innovative, and they have mobile farmers markets. So they'll go to a senior housing development, and they'll actually bring the products to them. Or they'll let you order what you want, and someone might deliver it to your home. So there's a lot of ways of looking at how to use farmer markets to increase consumption of fruits and vegetables. So we do these foods assessments so that we can see where the food deserts are, and then try to target interventions for improving access. And then again, looking at zoning and land use for things like community gardens and school gardens. And then our physical activity, we have our Safe Routes to School initiative, where we have most of our Mass in Motion communities having at least a day a week where they're encouraging kids to get out and walk. We really want to see that this is a changed behavior, not sort of a once-a-week event, but really that walking to school is a safe and easy way for people to get to school on a regular basis. Again, encouraging complete streets designs, incorporating health outcomes as part of the goals in master planning, comprehensive plans in municipalities, promoting sidewalks and biking and walking trails. We actually have many in Middlesex County. They're connecting an old aqueduct system, and they're turning it into ultimately is going to be about 40 miles of walking trails, and they're really quite lovely. I think we have about 5 miles of walking trails to date. Simple policies like snow clearance. In the wintertime, it's really dangerous to get out and walk, particularly for more senior population who might be a little bit more unstable on their feet. And so a simple policy of keeping your sidewalks clear will allow people to walk more regularly. And then mixed use of community facilities. In some places, schools are signing memorandum of agreement with the municipalities and opening their buildings up at night. So again, people have a safe place to recreate. Springfield does this. They have a lot of unsafe neighborhoods where people aren't comfortable getting out and walking, but we have Springfield College there. So Springfield College has a mixed use agreement with the municipality. So in those cases, we try to provide legal technical assistance so that the facilities can work with the municipality and come to an agreement of how the facilities will be used, how there will be maintenance, and how they will share that responsibility. And then in ending, Mass in Motion Kids is really just taking this to more areas of a child's life. It's building on our success in Mass in Motion. It's enhancing connections between the sectors. It's really looking at the family life and the nutritional status in the family and how they're and where they're having their meals. It's looking at clinical intervention, so when a child's going in for any kind of interaction with their doctor or their nurse, that there's an assessment about their weight status and their nutritional status and their physical activity. It's curriculums in schools, and it's programs in daycare. And so there's an intervention in each one of those sectors so that we really are impacting the child in all aspects of their life. So again, our goal and our output is to create healthy places for children, and that we have this multi-sector approach to population health interventions. And then just, again, it's important to collect data on this. We really have a comprehensive way of looking at what we're doing. We are using some existing data that we've collected for years, but we're also doing some targeted surveillance in communities where we have these interventions. And then we're doing the same kinds of surveys in comparison communities that don't have those assets that are being developed, so that we can look and see, are communities healthier when we do all of these different interventions in them? And first we're looking at, are there new assets in the community, and measuring how many new assets we have, and then are there changes in behavior associated with these assets? And then do we ultimately, our hope in 5 years is that we'll start to see that chronic diseases are going down because of that. And so then we're also going out in the field and we're measuring grocery store receipts in the communities where we have this focus on healthy eating, and then comparing them to communities that don't have that, or people starting to buy different things at the grocery store so that we can see what the patterns of our behaviors are. Or how many convenience stores have healthy options available, how many restaurants have healthy options on their menus, and then how many parks and streets and sidewalks are there. And we actually are having interns in the summer then go and measure how many people are actually walking on the new sidewalk. So it's not just that we built a sidewalk, did somebody really use that sidewalk, so that we know that these interventions are effective. And then our hope is to link this to the electronic medical records in the places where we have our clinical interventions, so that we can actually measure our biometrics and see that we have actually improved health. Thank you.